Hello everyone. Today we'll be talking about Kramer staging in jaundice. Kramer's rule describes the relationship between serum bilirubin levels and the progression of skin discoloration. Clinical assessment of jaundice. So area of the body. So the face, you'll see discoloration of the face when bilirubin levels reach 4 to 6 milligrams per deciliter. Discoloration of the skin of the upper trunk when bilirubin levels reach 6 to 8 milligrams per deciliter. Lower trunk and thigh when bilirubin levels get to 8 to 14 milligrams per deciliter. Discoloration of the arms and lower legs when bilirubin levels reach 14 to 19 milligrams per deciliter. And discoloration of the palms and soles when bilirubin levels reach greater than 20 milligrams per deciliter. So some textbooks have variations in their bilirubin levels. So this is one of them. The other one is this, which basically says that zone 3 is 8 to 12 milligrams per deciliter, zone 4 is 12 to 14 milligrams per deciliter, and zone 5 is greater than 15 milligrams per deciliter. So different textbooks have this variation. So if you just look at the diagram, it's basically schema for grading the extent of jaundice. So grade 0 is none, grade 1 affects the face and neck only. And then the bilirubin levels were 4 to 6 milligrams per deciliter. Chest and back, which is 2, is 6 to 8 milligrams per deciliter. Then abdomen below umbilicus to knees is 8 to 12 milligrams per deciliter. And then arms and legs below knees is 12 to 15 milligrams per deciliter, and affecting the palms and soles of hands and feet are greater than or equal to 15 milligrams per deciliter. So basically that's all about the Kramer staging. If you like the video, please like and subscribe as well as comment. Thank you.